My name is Vera Kohut. I'm a family physician. I've been in practice for over 30 years. My practice has predominantly always been in the Toronto area. I now practice in urban Toronto. I function really in two roles. At the present time, I continue to be a family physician working in an innovative clinic by the name of Healthcare 365. Healthcare 365 really is an entity that has two components. One is we actually see patients who choose to come to see us because we will give them more time, or they have complex medical conditions that they feel that they would like to have some extra care for or some extra attention around. And on the other hand, what we do is we're kind of an IT management company in which we develop patient management systems. In our clinic at Healthcare 365, we utilize a number of human resources in patient care. We have physicians, we have nurse practitioner, we have nurse care coordinators, all of whom have some role to play in a patient's care. And so different people in the clinic use Isabel in different ways, all of whom have found that it has been very helpful. We find that having Isabel in the background for us as something that we can refer to ensure that we've actually algorithmically gone through our diagnostic process appropriately can be very useful. Our staff also tends to use the 5-minute consult and tends to use the patient handouts because they're very easy to use and patients really like the information that is given to them. I think most of us here in the clinic probably use it as a adjunct after the client has been here, when we're completing our summary on the patient, when we're completing our electronic record on the patient. And in the process of doing that, as we're coming up with our differential diagnosis, if something is sort of sitting uncertain in our minds, or if we really still haven't felt that there is a sufficient clarity, that is when Isabel can become helpful. But if you're in an environment where the practice is broad-based and there are many different kinds of clients, both from the standpoint of age and from where they come from, and that includes other parts of the world, or if you have clients that travel, or if you have clients that have complex medical conditions in the practice, I think the use of Isabel is useful. Isabel becomes more useful under those kinds of conditions. I certainly think that anybody who does hospital work will probably find that it can be very helpful because by the nature of what happens to a patient once they're in hospital, they're usually patients who are sicker or may have conditions that are less easy to define, and it then becomes valuable to ensure that they're being treated appropriately, or at least the proper differential diagnosis being made.